Now or never.
Okay. Well, hey, everybody. You'll probably be watching on the playback when we finally post this, but want to welcome you to our first Healing Insight. My name is Marina Mangano. I am the new author of Gift of Healing Hands, which, Brandon, when you write a book in the future, I've learned you have to show it. You have to get it in the picture the whole time.
Yeah.
And this is my good friend, Dr. Brandon Reed. Hello, hello.
What's up?
Yeah, please just get us started. Introduce yourself a little bit. Let us know where you're at, what you're doing, and we'll go from there.
Yeah. So I am Brandon Reed. Marina and I went to school together. What's that been? I don't know, a handful of years ago.
Mm-hmm.
And so I grew up here in Kansas City, where kind of right around where we went to chiropractic school together. Moved away to Nashville for a couple years to work, and I am back, baby. So opened up a little practice. It's been this is month 11 now, so I'm coming up on a year of my own practice. So I just basically rent a room at the front of a CrossFit gym, just me and my hands and a table in a small room, and it keeps my overhead nice and low. And I get in front of those CrossFitters that I like to see and that need a lot of help and a lot of treatment and stuff. So it's a really good situation.
Yeah, that's so awesome. I mean, that's pretty much kind of where I am currently in my practice. Again, I'm in a room in a larger facility. It's a full functioning Pilates studio. There's a physical therapist here in my office. And so together we have this integrative wellness practice, and I brought in that yoga component. But it's so wild to see how many times we've changed, how our practice has changed in school. And it also makes me laugh. I have to say it. When we were in school, I don't know if you remember, but one time, chiropractic students are really kind of given this autonomy that I don't know if a lot of other healing practices have, like PTs, definitely orthos. And we're given this idea of you can make your business whatever you want, but you have to really capitalize on a niche. Do you remember that being a huge theme in school?
Yeah. Oh yeah.
And I remember just joking about you're going to graduate, you're going to completely change what you look like. You're going to get a man bun, and you're officially there, Brandon.
Let's go.
You're officially there. I've got my bangs. I'm rocking with the yogis. So I think as a student, I do remember Dr. Campbell asking, hey, how do we find our niche? And his response in a big, classroom, finally got serious for a second, thought about it, and said, you don't, it finds you.
Yeah.
How do you feel? Do you feel your practice was already starting to change into maybe, a little bit more of an outlet that attracted the CrossFit and the gym that you're in? Or do you feel maybe your life and your interests were changing? Which way do you think that went?
Ultimately, I'd say a little bit of both.
Yeah.
When I was down in Nashville, the practice that I was working at was very similar to the way that I practice now.
Mm-hmm.
So that's obviously shaped kind of my preferences, and I took a lot of what we were doing down there and I implemented it. And then I left a lot of the stuff behind, kind of the stuff that I didn't like, I didn't see myself doing.
Right.
And I brought that here, and we were I was treating kind of the same population, very active people that, had something to get back to doing.
Mm-hmm.
Plenty of those people were CrossFitters. Others were just, they hiked on the weekend, or they did some other type of hobby athletics. So right. I really kind of fell in with those people, and I enjoyed the fact that they had a little bit more skin in the game. Right. So because of the fact that they wanted to continue doing their hobby, and it was a more active hobby, right? They weren't like Netflix hobbyists where they go to work and then their only hobby is to come home and watch a bunch of Netflix. So no, they had active stuff to get back to.
Right. That's a great way to put it. I like that. The skin in the game.
Yeah. And so I really learned that those people kind of take my advice and they listen to what I have to tell them a little bit more than just kind of, Joe Blow who goes to work and then comes home and sits on the couch.
Right. And one of the initial reasons that I wanted to do this today, I'll backtrack a little bit before we get too far, was you and I have a pretty similar, what I call chiropractic upbringing. So, maybe we had different undergrads and everybody has different experiences of their own pain, their own medical procedures, surgeries that probably land us in chiropractic school anyway. But it's really like within school where I describe in this chapter how much variety there is in our field. And I find that a lot of patients don't know that there is so much variety in our field. And so of the, few small collective people that I would say have a similar upbringing, you are one of them. You've been exposed to that foundation of chiropractic. We went out of our way to find like very active, very rehabby things because it was easy to relate to. It was easy to talk to those people because we were those people. And then later down the road, you and I were both exposed to a little bit of like these more like outside the box type of techniques, or like a little bit more this idea about like emotional pain and some other things. So what I really want to talk to today is not just like necessarily why we love like to be athletic chiropractors or functional chiropractors, but the idea of like how people find you. Do you find, and if any like big stories pop out in your mind, do you find most people are really excited to be in with you? Do you see like a fatigue when people come? They're like, all right, I'm going to try one more time with one new person. How do you help people feel like they've found a safe space that they can be at for a while with chiropractic, basically?
Yeah, I have kind of a mixed bag, right? I've seen plenty of people who it's kind of their first time being injured. They haven't really dealt with much, especially some of the CrossFitters at the gym, just since I've been there and they know me from being around.
Right.
I've seen quite a few of those people where it's kind of their first go around with musculoskeletal pain. And that's pretty easy ultimately.
Mm-hmm.
And then I've had, some other people who have kind of been through the ringer. And at that point, I think it's just having a conversation with them, and saying, hey, what have you tried? What have you not tried? What do you think? And I find that most of the time people will give you the answers too, right? So like, I think a good listening ear and a lot of time is something that we as chiropractors can kind of shape our practice to be able to provide value in that way.
Mm-hmm.
So if I sit down with somebody, my new patient visit is a full hour long.
Mm-hmm.
And so I'm going to sit down and I'm going to ask them any and every question that may or may not be related to what they're dealing with. And then I'm going to give them time to respond,
Mm-hmm.
and ask plenty of follow-up questions. And most of the time they end up giving you kind of the answers, in their own words.
Right. Well, give yourself
Have to
credit
be.
though. Yeah, that says something about the kind of doctor you are. And that's one of the reasons I wanted to talk with you specifically today, is because, we've designed a practice that maybe we would have wanted to go to. We would want a little bit longer time with the doctor to talk about things, or just to feel like there's no, hey, I know this isn't really like your thing because you're a chiropractor, but do you think this is relevant? Like, exactly. If you give people this, set the pace, set the stage, give them the safe space, they often bring those answers to you. And then I see so many people who maybe I've never been to a chiropractor as well. Like, how do you try to explain to someone new, not that like you're trying to like help them get to your office. Like once they're there, once they're in front of you, what's like a really pretty consistent few points that you try to make with new patients so they know what they're getting into with you?
Yeah, the easiest way I've found to describe it, where people just like, it just kind of clicks without me having to like launch into a 10-minute type of spiel to kind of sell myself, is that I just tell people, I'm like, hey, I'm basically a chiropractor PT hybrid.
Yes.
And so like, while I have the skills in adjusting that almost every chiropractor has, I also do the other stuff that maybe you would associate more with like a physical therapist. And I combine those things and get, kind of the outcome. Hopefully I'm, getting the outcome of you seeing two providers at the same time, basically.
Yeah. Yeah. No, I say the same thing. And then even more so, remind me, have you done like dry needling or any acupuncture?
Yep.
Yeah. So you're more than two providers. I mean, ultimately, and that's something I talk about in this chapter here, is we are a collaboration of almost like 300 years. If you think about all the mentors who like grabbed you under their wing, taught you, students, like we are a collaboration of so many years of clinical practice, and we've only been in practice, you know, relatively short amount of time. But I joke, I don't know if you're in an area that you have someone you go to get adjusted, but like, I don't really have a chiropractor here. And what I know I would get with you, I would have to see in comparison, a chiropractor here, an acupuncturist here, a massage therapist here, and then I go get like Reiki healing, you know? So you are definitely more than two providers. And it's hard to not sell that. I don't like to use that word, but it's hard to get that across to people because you know your value and you know what your interests are and what you're looking for. So the power of what I wanted to relay in this book really is how we started to define our message and how we start to change our message depending on like who's in front of us. You have to be that chameleon, right? Like to match that person. And I really do think chiropractors are just wonderful, like health advocates in general. In your experience and like people who inspire you, what do you look for in a practice and a provider that just makes you really proud to be in the field?
I mean, like you said, I look for somebody who's kind of practicing what they preach. And one thing that I'm really big on is growth in any capacity. You know, I think the minute that we get complacent as humans, as business owners, as clinicians, you know, as soon as you stop growing and you kind of settle in and just like, you're not striving for something better in some area of your life. I mean, I think that's dying a slow death ultimately.
Yeah.
Right. Like you gotta be striving towards something.
That kind of reminds me of like a little bit of the new name and title you've been following recently. Tell us a little bit about the trajectory.
Yeah. Trajectory Spine and Strength is the name of my practice. And so, yeah, that's kind of what I wanted to convey with the name of the practice is like, hey, the trajectory, what is your trajectory at this moment in time? And if it's not a great one, if you need to be kind of set on a different path or, you know, boosted somehow, I want to be the guy to kind of help change that trajectory and get you to where you need to be.
Yeah, I love that. And also that doesn't say here. That doesn't say, and in that mission statement, you're not saying like, I need to keep you here because this is where you need to be. Like, this may be a good transition into one of my maybe laughable points of this chapter for you, but good things for me. I think that is a true clinician. Well, you know, I describe the difference between what I think a clinician is and a healer in my book. So clinician is, you know, all the skill set, all the experience, all of the like research-based things, like really beautiful scope of practice-based practitioner. Absolutely wonderful. The transition and the trajectory that I've taken after school, and I've really connected with a lot of other providers that have found that same path, is the people who really value that, but then wanted that extra, like the empathy in the doctor, the understanding how you observe, how you interact, body language, and all of those extra things, I think, make a healer. And one of the best things about a healer is recognizing when you are not the provider for the person who comes in the room. So I really like that idea of the trajectory. So we're going to go through these, and I would love for you to like eat me up, add to it, like just, you know, have a good time with me on these. But we are biased. We have a certain niche in our practice, you know, so we've probably been on the receiving end of the style of practice that made us want to pursue it as the doctor. But I made a list relatively of about 5 things to call a new chiropractic office, and like put the responsibility, give the power back to the patient a little bit of calling this office and almost interviewing them. Like, I want to know why you are a good fit for me, you know, before coming in and spending a lot of time. And also, I don't know, Brandon, if you know, I live now in this back home where I grew up. So very kind of cool. We're both back where we started. And it's an island. It's a seashore, like very seasonal summer place. So I have the luxury of meeting people from all over, but I don't have the luxury of taking people through care plans. So I may see
Right.
someone like once, twice while they're here on a weekend, never again. And so I was getting bombarded with like, hey, I love your style. Oh my gosh, my body is just really responding. Who do I go see at home like you? And I never leave people hanging. I'm like, all right, give me your address. Like it takes me 5 minutes to just do a little Google search around their address. And I can tell almost immediately different websites like, oh, that is not the person I would send my patient to. So this list basically came from those kind of things, like way for me to like reel that in.
Yeah. Let's hear them.
Yeah. So number one, I have them call and ask, how long will I be in contact with the actual doctor? Simple, straightforward. I don't mean how long will I be in the office. I mean, like actually me and the doctor are going to be with each other today. You said, what are your follow-ups usually time frame wise?
Half an hour. Yep.
Yeah. Yeah.
So I mean, I go for a long time, but I've heard people coming from other chiropractors that, and that's, part of my deal, right? Is like, they'll say, well, that's pretty expensive for a visit. And I say, well, what'd you pay your other guy? And okay, that amount for how long? And they're like, well, I was in the office for 7 minutes total. I saw the doctor for 4 of those minutes. Right. And I'm like, okay, so you're going to be with me for the full 30 minutes and only me.
Yeah.
Yeah. So, and I love that model.
Absolutely. It builds such a different relationship with the patients. And then that, that bullet point, that question basically helped me introduce the idea of, not that I want to ever talk bad about a different realm of healing, because everybody finds their own medicine, but this whole book is from my experience. So I'm going to talk about the things that I found the most beneficial. It talks of the difference of consider it a high volume practice versus kind of what we do, a little bit more of that intimate time frame. Yes, we may see you for a little bit longer that day, but probably overall, we don't have to see you as much, or those people get really nervous about paying up front of things and care plans. And I'm getting ahead of myself. That's a different question. But I just say, ideally I hope that you would get an answer that you'd be in response with the doctor for, greater than 10 minutes, 10, 15 minutes, I think is a minimal for me of what I wish you would have interaction wise. Number 2 is, does the doctor adjust with their hands? So, we are taught to be manual therapists, meaning, like you said, what did you say I first started? You're like, hey, it's just me, a table in my hands in the back of this CrossFit gym.
Yep.
All the other stuff is so wonderful, but if you don't have this foundation, there's just such a barrier to connecting with somebody. So I describe here in the follow-up that I think it's best to work with somebody who understands their hands, but I'm sure you use other auxiliary tools right after that.
Yeah. I mean, I have anything and everything in my tool belt, and it's ready to go. I've actually had a shocking amount of patients come in for neck pain that have seen other chiropractors, been adjusted by those other chiropractors, and then don't want to be adjusted.
Yep.
And I kind of bring it up. I'll just be feeling around and I'll say, hey, I think you could use an adjustment. Is that something you're comfortable with? And they'll go, no. And I'm like, didn't you say you saw the other guy? And the response I've gotten back in this situation every time is just, well, yeah, he just grabbed my head and did it.
No,
and so I just I don't want to be that guy.
You can't get that trust back. And I really like how you described yourself earlier, that hybrid between the chiro and the PT. Because I work in an office with a physical therapist, I am a lot of people's first experience with chiropractors, or first experience after, like you said, a long bit, 10 years, a bad experience with another chiropractor, and they've held off since then. So now they're finally broken down this fear, and they're in my office. I am never going to be that person to shock them and be like, I know you said you don't like it, but I know better. So wham, all that kind of stuff. And so many people that I treat, exactly the same situation, maybe a couple of visits in, maybe once we get to know each other, they really know how I have so many other things to do in their neck besides adjust. There's so many things that we can do. Maybe down the line, if I say, hey, I really think it's time, or I think you are going to hit a plateau until we can get past this. And they're usually ready at that point.
Yeah.
They've trusted your hands. Would you agree with that question though, that that's a good kind of foundation? Yeah.
Yep. Absolutely.
And people don't even know that there's chiropractors who don't use their hands. Or some people come in, they're like, yeah, I went to that guy with like the tool thing. And they're all wonderful tools, but again, this is my experience. This is what I get to share. I think the best way to connect to somebody is hand contact and manual adjusting. Number 3 is, are there memberships or prepaid treatment plans? Again, this is a different practice model than anything we've been taught, in our realm of care. But for me, if someone comes in, and I don't like to use the word fix, but if I could help decrease their pain in 3 visits, but they've already paid for 13 visits, like, what do you do the rest of the time? How do you feel with people coming into your practice who have maybe been part of a membership or care plan like that before?
Yeah. So I'll kind of flip this back on you. And this is something that, again, I never would have thought that I would be doing, given our experience and kind of some of our mentors in school, is I sell prepaid care packages.
That's great.
In my practice. Now, the distinction there is that they're not huge, right? Mm-hmm. It's like 5, 7, 12 visits.
Right.
And if I can't get the job done in that amount of time, and even, I generally recognize around 3 or 4 visits if I'm going to be able to help that person or not. It just kind of depends on how long they've had their injury or whatever they're dealing with, how many injuries or things that they're dealing with, things like that. And then with me being in the CrossFit gym and the amount of rehab knowledge that you and I both have, is that even if they're out of pain, we can still find performance goals then to strive for. So my goal is to get people out of pain in 3, 4, 5 visits. And then we have extras on the back end to either do like maintenance type stuff where we've stretched it out a really, long amount of time, or they're in the gym and we're working on performance-based goals.
Okay. Yeah. And so I'll play like, the patient here who maybe have had a bad experience with that or something like that. How do they approach you with saying like, hey, if this isn't what I need? Like, so for example, when I meet a new person, I tell them, hey, I'm a mechanic, I'm going to do very mechanical things. And I will get to a point where I know if I'm helping or hurting you, it's a mechanical issue. If I can't affect you at all, I know that you are not supposed to be with manual therapists. We need to go send you off for blood work, hormones, like that kind of stuff. So when someone asks you like, hey, if I want to start doing this with you, if this is not the right road for me, how do you address those situations? What do you say to them?
Yeah, it kind of depends on, I'm not making any of these recommendations right up front. So I kind of bring them in for a new patient visit, do my assessment, and then get a feel for like, well, how much progress did we make, with some of these movement tests that we're doing, or with some of our treatment stuff that we've tried. Generally, if they respond well, then I can make a good estimation of like, yeah, I'm going to be able to help you. And if not, I continue to just say, hey, this is an experiment, or we can take this one visit at a time. I of course have that as an option. And I always allow people to kind of prorate those if they are a little weary and they get a few visits in and then they're like, oh yeah, this is going to work. And I do want to do some of the performance stuff. Then we just tack them onto a package at, a little bit cheaper rate and stuff like that. But yeah, I mean, I'm never above booting somebody off to a different provider. Anything like that.
Setting them out. And so, really though, the effect of this question is still very good, that it even started this conversation between you and I feel like I know so much more about your practice because this conversation came up. So, I kind of prefaced it almost in like a negative light, but if in just someone calling you and not knowing you and kind of being drawn to your type of care, this would be a really good conversation starter. So kind of happy that I have it in this list of people calling.
I would, the only caveat I would add is like, I mean, I think it's a great question. I think you just need to get them to expound upon, kind of what they're offering. Long-term is the one kind of phrase I would add is it going to be a long-term thing? I mean, my goal is to never treat anybody for acute care longer than a month.
Right, right. And that's what, yeah, luckily I'm happy I didn't, I'm like reading this. Luckily I didn't say anything negative or deter anybody in that, the bullet point. It's just saying, I prefer someone who gets to you quickly and efficiently. So,
Yeah.
a care plan, I almost tell everybody, a new patient I meet, if they're living here and I'm going to see them, is I usually see new patients like 4 to 6 times. So while I may not be making them pay up front, I'm definitely communicating the expectation and what I've seen success rate wise, getting things to not just feeling good in between me, but that permanency and optimization that you talked about. So very good caveat. I'm glad I brought that one up. Thank you for adding to that. Number 4 question is, does the doctor release patients? So right away, what does that kind of speak to you of like type of quality of practice?
Yeah, that is, and again, I didn't think that I would be doing, or maybe not pushing is not the right word, but nothing better is coming to me. I didn't think I would be such an advocate for maintenance care as I am.
Yeah.
But again, the kind of caveat there is that I'm seeing people once a month, once every 6 weeks, once every 8 weeks, once a quarter. It just kind of depends on what people feel is going to be best for them.
Mm-hmm.
Definitely not every other week or anything crazy like that.
Yeah.
Yeah.
Yep.
And I certainly give them the option too. Right. So at that point, I'm not forcing you, you feel good right now. I've given you the tools that you need to help yourself. If you like being adjusted, and I'm one of those people who, hell yeah, sign me up for once a month. Like I love the way I feel after I release those joints and stuff with a little bit of help. But I'm never going to try to lock anybody in. I'm not going to fight them too hard if they want to go and do their own thing,
Yeah. And you have to that's where, as I said in the beginning, we're very open in chiropractic to designing our own business models. And you have to match your clientele. You have to match your population. So if you are working with like pretty systematic, routine, like I know CrossFit have like a designed template that they're following workout wise, those movements are so beyond just like the normal daily movements of life that if they're doing that every day, of course they're going to need some tune-ups. Of course there's going to be slips here and there. So that type of question, I hope, just sparks that idea, that conversation of where is this going, I guess. So there's no like, I want people to be gone from this practice, or I think, don't go to that practice if they say no. But I hope it just opens a conversation with, probably this person's going to catch the front desk staff of a bigger office or something like that. But if they're lucky and they get to talk to either you or I, these like, solo practice type places, people will really get a chance to know us just through some of these simple questions. And really the most important of all of these for me, for any of these hybrid chiropractors, is number 5, does the doctor offer any soft tissue therapy? Seems simple to us and you're like, what are you talking about? Like, why wouldn't they? But people are so surprised when, if that hour-long, new patient visit, or I'll say like my 30-minute follow-up, if I adjust in the last like 2 minutes. Everything I do up to that point is positional, rehab-based mentality work, deep soft tissue, like very neurological things. And that's very weird for chiropractors. So how important is soft tissue in your practice, soft tissue work?
Yeah, I do quite a bit of hands-on work. Yeah. And there are times when I've sent patients away without adjusting them, simply because I had so many other things going through my mind. Like I need to address the soft tissues. I want to get this, I want to get their home exercise routine figured out. And then they'll just, they feel better. And I'm just like, I just wrap it up. And as they're walking out the door, I'm like, oh, damn, I didn't even adjust that person. Now that's kind of the exception to the rule. I certainly don't do that with most people, but it's happened before. So I think that gives testament to the fact that we can be just as effective and still not do the one thing that we're known for as chiropractors.
Yeah.
So yeah, it plays a huge role in my practice for sure.
Yeah. And, if you were in an area where somebody was visiting and you wanted to send them to someone in their hometown, I would imagine that would be the meat of your recommendation is, go somewhere that has this alley in their practice.
Yeah, for sure.
Absolutely. And, soft tissue, like if you're not familiar with what that means is, there's a lot of really common protocols. You'll see chiropractors, definitely sports chiropractors using a scraping tool, or now in more holistic care, we use like a gua sha tool, just deep trigger point therapy, myofascial release. These are just all things that are finding imbalances in your musculoskeletal system, knowing that your brain controls how those muscles are coordinated, and there are always going to be some things in the way, whether it's like a joint issue, that's what we would handle via adjusting. Whether your brain can't talk to that muscle, which is really common, and that comes from a lot of, we would fix that with a lot of like training positions, breath positions, releasing and like adhesions or scar tissue. And for me, and why I include it in this book for specifically, is because it introduces a lot of these next chapters, which are just the things that come out of people when we're working on soft tissue, the weird stories of, oh, I forgot, that one time I fractured my leg, or, oh, didn't I tell you I had that surgery? And I'm like, you did not include that on your new patient paperwork. No, you didn't. But if I never got into that depth with people, I think we would miss a lot of information. Do you have any like things that really stand out to you, like any weird stories like that of just people telling you stuff after the fact? Or
not that come to the top of my mind, but one thing about soft tissue that I always find interesting, I'll say, is that most of the time, so I put a caveat on all my soft tissue work. I say, hey, I don't want this getting above a 7 out of 10. So I don't want to beat you up too bad. I don't want this to be super uncomfortable for you, but some of it might be, hurt so good. I want it to hurt so good and not hurt so bad. That's another phrase that I use. And a lot of times people's response is like, oh, don't worry, I have a high pain tolerance.
Like it's a badge of honor. Yes.
Yeah. And most of the time, if it's a woman and they say that, I believe them. I'm like, okay, I bet you're not messing around. And then all the dudes, it's always like, big macho guy. And he's like, oh, don't worry, I have a high pain tolerance. And you get in there and you're using
barely
minimal pressure. And those guys are rolling on the table and groaning and moaning. So that's just, that's something that I find funny every time I do some soft tissue on people.
I see that a lot. And I just don't think those, I hate to stereotype, it's not always the big stiff guys, but I just think they don't want to see the intolerance in their body. Like they don't want to see and get to know those little intricacies of their body. So I think between the combination of like the foundation of what we do and those funny soft tissue moments, if nothing else, I just hope people leave with like new information about themselves, like how they view their body, how they view like where they want to go with it. The skin of the game. I like that a lot. And then I always say too, with my soft tissue is like, it doesn't have to hurt to help. I see pictures of people cupped and scraped and they're bruised and they look like they've just been created, like inflammation has been newly injured in their body. And I think that scares people sometimes. And so just like with our shock adjustments, it's really important for us to like creep to those things, properly explain them, communicate them. And I think overall, these 5 questions would give someone like a kind of good depiction of your practice. Is there anything that you think that's a loaded question, but is there anything you think that I missed that you would want someone to ask?
The 2 things that so this is actually a really good exercise, and I'll probably sit down after this and kind of write down, some of my caveats and things that I want people to ask. But 2 things that I'm constantly reminding people that a good provider is going to do for you, and this is any provider really, specifically one specific for musculoskeletal stuff, and that's exercise.
Okay.
I think if a provider can give you an exercise to help you help yourself when you're not with that provider, I think that's totally invaluable. I think that is an A+. That's a win for you as a patient. And then the other thing is education. Again, if they can give you tips, tricks, advice, anything like that, I think you're on the road to getting better faster. And I think you've found yourself a great provider.
That's great. I mean, these are meaty questions, right? So even just asking these over the phone and someone has the time to answer, that's already pretty telling of the kind of care you're going to, get in this office. Well, I think we're almost up on time, but I think that was really opened my eyes on a couple of things, and I'm really happy we kind of got into the nitty gritty of that list. just in closing, I think we really hit a lot of the things I wanted to talk about. Overall, I'm just really happy to be a chiropractor. I can't imagine myself doing anything else. And I look forward to the continual growth in my own, not even just career, but maybe my gift beyond just being like a manual therapist is to help people find this career. So whether that is through things like this book or, communicative outlets through yoga. Why are you so proud to be here?
I'm proud to be here, man. I just, honestly, I like helping people. I like educating people. I like, putting the power back in people's hands. So yeah, those two things that I've just mentioned, education and exercise, I think you can go really far if your communication skills are on point. And, you don't even necessarily have to have the adjusting skills or the soft tissue skills or whatever. I just think if more providers could provide that for people, education, exercise, empowerment, really, that's really what I love to do.
Yeah.
I love sending people off on their way and they come back and they go, hey, I had a little bit of bout of pain. I didn't freak out about it. I did my exercise and I handled it myself.
That's great. Yeah. And so you had changed their perception at some point or gave them an opportunity to remember their ability to heal. You are the leeway into healing. We aren't always like fixing people, we are just kind of getting things out of the way so people can heal themselves a lot of times. So
yeah.
I'm so happy to talk to you about this, and just great seeing you in general and your new hair. I wish you the best of luck in your new realm, and thank you for all that you do for everybody.
Yeah, you got it.
All right. Hope to see you soon.
Right on.
Bye now.
See ya.